Unpacking Cannabis Use and Mental Health in Métis in Manitoba. Voiced by Julianne Sanguins, Research Project Manager, Manitoba Métis Federation. This project explored community perceptions about changes that may have occurred within the Métis population since the legalization of cannabis for recreational use. Following key informant interviews and discussion groups, the project team employed knowledge translation strategies to share the evidence generated to inform policy development. This project was carried out by researchers from the Manitoba Métis Federation and the University of Manitoba. Julianne Sanguins.
The Red River Métis is made up of descendants of the Métis people of the Red River Valley and others who can show their ancestral connection to the historic Red River Métis. The research was important because it was identified by community members that this is an issue that they were concerned about. We looked to provide valuable and culturally relevant insight into the relationship of cannabis use and mental health among Métis citizens. One thing we found out when we were doing this research is that people were particularly concerned about the use in youth, and if 25% of our population are under the age of 15, that probably speaks to a reason to be concerned. We addressed the research from a point of view that using cannabis wasn't a bad thing, but rather to gather an understanding of it, if there had been an impact on the mental health of citizens. Previously to that, we'd known that we have higher rates of depression, anxiety disorders, and substance use among our people. So since cannabis had been legalized, and presumably more people were using it, we wanted to know if there had been any changes in mental health status or the need for mental health services. So what we learned was that there were insufficient resources in our community to support any type of mental health issue. We also learned that citizens felt that if it grows from the ground, as do many of our traditional medicines, that it is a part of holistic healing. Well, our citizens are used to coming together and being consulted on different issues, so the actual getting people to talk in discussion groups wasn't problematic. But because we had to do our course correction from going out to the communities and actually having people involved over Zoom, sometimes the technology was problematic. It took a bit of getting used to, but I think that we achieved our purpose without it being a problem. We'd really like to take this opportunity to thank the Mental Health Commission of Canada for funding our project, but also for the ongoing support throughout. It was a really positive experience to be part of a national network of different groups working on cannabis, but from very different perspectives. We really appreciated it and learned a lot.
Mental Health Commission of Canada, mentalhealthcommission.ca. The views represented herein represent solely the views of the research team. Production of this material was made possible through the MHCC's cannabis and mental health research initiatives and a financial contribution from Health Canada.